O God of all creation, blessed is our nation. Just is the shield and defender. May we live in unity, peace and liberty. Plenty be found within our borders. Let one and all arise. With hearts as strong as June. Service give our honest endeavor. And the homeland of Kenya, heritage of splendor, from where we stand to defend. Let all with one accord, in God united, build this our nation together, and the glory of Kenya, the fruit of our labor, fill every heart with thanksgiving. Mungu twaomba uilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu. Uzalendo pia mshikamano viwe msingi wa umoja wetu, na tulinde uhuru na amani, mila zetu na desturi zetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu. Viwandani na hata mashambani, tufanye kazi sote kwa makini, tujitoe kwa hali na mali, tuijenge jumuiya bora. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Okay. Can we pray, Rachel?
Yes, yeah. Joshua, kindly give us a word of prayer.
Okay. Thank you. Let's pray. Our Father who art in heaven, we come before you this morning. I give you thanks and praise for all the blessings and mercies. We do acknowledge that you deserve all these praises and thanksgiving for the far you have come in this country while handling the pandemic. So we pray that you may guide us in this meeting. From all the deliberations we are going to make, we pray that you may guide us. Bless everyone attending this virtual festival. And so bless the creatives behind the different submissions, God. We also want you to bless the panelists and moderators, oh Jehovah God, who are going to engage us in this festival. Remember everyone in this country. We pray that you may bless each and every person. It is through your holy name we do pray and believe. Amen.
Amen. Thank you, Joshua, for that opening prayer. We are indeed very happy. It's been a long journey throughout the Boresha Afya Jenga Jamii Audiovisual Festival. My name is Rachel Wainaina, and I'm the festival director for this inaugural event. It's been a pleasure for the creatives to be given an opportunity to work with the Ministry of Health in this very worthy endeavor of educating the Kenyan society on matters health education. Of course, a healthy nation is a productive nation, and without this health education, we are only going to exaggerate the current situation that we have, especially following the negative effects of the COVID-19 pandemic. So this festival is an idea that came in the very best time when the Division of Health Promotion, MOH, was trying to engage stakeholders in response to the COVID-19 pandemic that had and we continue to suffer from globally. And so the Division of Health Promotion saw it fit to partner with creatives, putting into place the Audiovisual Technical Working Group for Health Education that comprises of filmmakers from across different counties and creatives, musicians, people working in the creative industry from different counties in Kenya. So these creatives have played a major role in making short videos, making, the most creative pieces that really helped destigmatize COVID-19 and also helped, just put the education out there and helped in keeping many Kenyans safe. So in that regard, that's why we thought that it would be important to bring this work and appreciate it and award it so that everybody can see what kind of work has been going on. And this morning, we've been screening a lot of the work already. I'm hoping you've gotten a chance to enjoy, and during the next 2 days, we'll also continue screening. We are happy to report that we had 163 creatives submitting in this fourth festival in 18 categories of audiovisual. This includes music video, it includes short films, documentaries. We had a special category for short films about COVID-19. We also had other categories that were involved in this inaugural festival, including TikTok videos, including monologues, spoken word. So this festival being inaugural, being the first ever health promotion festival that we hope to keep continuing to work with, is going to be very, very key in playing a role in bringing the creatives together. And today, to help us officially open this festival, we have with us Dr. Salim Mohammed, head, of course, in the department, which is in charge of the Division of Health Promotion. So, and we are lucky to have him as the keynote speaker in this, and we're going to go straight into it because we have a couple of panel discussions coming up, and invite Dr. Salim to come in and actually give us the keynote address. But before I can see, before we get back to Dr. Salim, I wanted to just ask you, Joshua, as the Deputy Festival Director, how has the experience been for you in this organization of the Boresha Afya Jenga Jamii Audiovisual Festival? Joshua, over to you.
Thank you, Rachel. Okay, so the journey has been great since the pandemic hit us in the country. We've really experienced quite some journey. So after the pandemic started, we saw the need of engaging creatives by involving them in the division. So we brought them on board. Actually, we formed a committee for that matter, and that's when Rachel came into the ministry, and she's been providing the technical expertise, especially in the field of audiovisual and production. So we came up with a committee known as Audiovisual Technical Working Group, and that's where we nominated members to the committee. So that's where the journey started.
Somebody
Sorry,
has an
I think you're getting some noise.
Yeah, okay. Dr. Salim, you need to check your
Okay.
mic. There's some echo coming from your mic, Dr. Salim. Maybe if you have, you can switch off one. Yeah. Okay, Joshua, continue.
Yeah, so as I was saying, that's where the journey started, where we brought on board the creatives into the ministry. So at the beginning, we just started by coming up with scripts from the creatives that we involved. So we are reviewing them and making sure that those scripts were up to the guidelines for the ministry. So after that, we saw the need of coming up with this festival, and you've been seeing the social media engagement, especially from the page of the Division of Health Promotion. So we brought on board artists to submit their creative works to the division through a website known as Film Freeway. That's where we started maybe engaging artists, and we've been seeing these submissions were some are really good, by the way, and some I think did not make it to the nomination. So that's the journey we've been having, Rachel and everyone. So I thank you for the leadership you've provided to us. I've been able to maybe learn a few things from you, especially in the field of production. But all in all, the journey has been great. So thank you, and over to you.
Thank you, Joshua. And now I would like to invite our keynote speaker, Dr. Salim, to give us the keynote address for this opening session of the Boresha Afya Jenga Jamii Audiovisual Virtual Festival. Welcome, Dr. Salim, and over to you.
Thank you very much, Rachel. I'm very glad. First, I want to thank the Almighty for enabling us, all of us, to come together in this virtual Boresha Afya Jenga Jamii audiovisual virtual meeting. I think this is very important for me. This is a very important collabo between the Ministry of Health and the artists, so that we can actually bring edutainment, entertain people, but giving them the messages for this pandemic. I think it has been a journey that we need all possible means and mechanism for us to be able to change behavior of the people. We know passing messages is one thing, changing behaviors is another. And I think for me, these innovations in creative audiovisual is one of the way that we can actually change behavior, because we can use this in the long term. This is enjoyable. People can actually associate with it, can relate with it, can enjoy it while they're getting the messages. So I think for me, this is a very important and urgent method of actually trying to change the behavior of people. As the goal of this objective, we want to have health promotion, health promotive behavior in the people through entertainment. So I'm very glad that we saw so many submissions of 163. I think that's a very good number. It shows the interest and the importance of the same. So I hope this collab of ours will be long term, not just because of the pandemic, but also in other health areas, so that we can actually move together and be able to change the behavior of people. We know in Kenya, the youth are amongst the largest percentage of our audience that needs to be changed, that needs to actually be on board. And I think this is one of the way that is the best way that we can get to them. So I hope that the artists that have come those who made it and those who don't make it, did not make it, actually feel that they are part of us. They are important. We always need to have some categories. On the same vein, I want to thank very much Rachel Maina, who is actually the festival director, for leading this, taking us through this. I want to thank very much the jury who were on board. That is including ZP, of course, who is from Kenyatta University, Rachel Odondo from CDC, Yoland Masidza, the head of the drama in Hillcrest Schools, Zeba Malima, who is a consultant with the WHO, Isabella Andrigo is our own officer at the Health Promotion Officer, Stephen Okwani, who is the founder of the Talanta Africa. So we want to thank these people for choosing for us. I want also to thank the technical working group, which has been working behind the scene to make this possible, and the artists themselves for participating. Hopefully that when we move together, we will be able to pass these messages in an entertaining way. Thank you very much. Over.
Thank you. Thank you very much. Thank you very much, Daktari. And now we would like to officially ask you to declare this festival open, and so that we can feel free and welcome to continue with all the activities of the festival. Over to you, Dr. Salim.
Thank you, Rachel. I once again want to welcome all of you and officially open this festival. Karibuni.
Asante sana. So thank you very much. I'm going to be excusing our guest. Thank you, Daktari, for joining us. And thank you for this wonderful initiative, for trusting us as artists. We have really indeed seen the impact of the Ministry of Health in the creative industries. And for that, we ask you to take our heartfelt gratitude to the CS, Ministry of Health, and to the President of the Republic of Kenya. And of course, I'm speaking on behalf of all artists in Kenya. Thank you very much for that. And now we are going to be preparing for the next panel. So I'm going to be bringing in the moderator of our next panel, Dr. Zipi Okoth, shortly. So don't go anywhere. So we're starting with the panel, which is dealing with matters of how to communicate, health, education. And so I just want to invite our moderator for that panel, Dr. Zipi Okoth from Kenyatta University, a lecturer, an author, a renowned filmmaker. Welcome, Dr. Zipi, and over to you. Dr. Zipi, I can't hear you. Your microphone. Hello, Dr. Zipi. Okay, as we wait for Dr. Zipi, I'm also going to bring on the other panelists who are supposed to be in this panel discussion. We have Dr. Ocheng. He'll be introduced shortly, but from the Division of Health Promotion. Welcome, Dr. Ocheng, to this panel. I'm also going to be inviting Joseph Silari, who's also going to be part of this panel.
Karibu. Welcome.
Welcome, Joseph.
Asante sana.
I'm also going to be inviting
Oops.
Okay. Yes, Dr. Zipi, can you hear me now? Because I want to leave you now on your panel. Can you hear me? Dr. Zipi, you need to unmute your mic.
Can you hear me now?
Yeah, we can hear you. So thank you, thank you. I want to hand over the session officially to Dr. Zippy Okoth so that she can move us to the next panel discussion. Thank you guys for watching, and we have a lot in store for you. For me and my crew, that is a ciao for us. And over to you, Dr. Zippy Okoth. Thank you.
Thank you. Thank you. Welcome, guys, to this session.
Mhm.
We are very glad to reach this level, and we are already having our guests. Uh,
Mhm.
we we just want to say Karibu na usitoke hapa. We're going to keep it strictly 1 hour. So
Mhm.
we're going to start now, and hopefully, we believe that by 12:15 we will break in time for your break, for your lunch break. Our topic of discussion right now is about health. It's about effective health communication in the midst of the global pandemic. We keep asking ourselves, is our CS doing the right thing? Is he giving us, making us feel like we're panicking? Is he doing the right thing, giving us information every day? Or is it too much for people? And how the information is given, is it right or not? And to join this panel, we have Dr. Athanasius. Okay, I hope I have gotten it well. We have got Joseph Silali,
Mhm.
and I believe that we are going to be joined shortly by our artist Amos. Amos is going to join us shortly. So, Dr. Athanasius, your name I think goes well with your profession. Assuming that maybe you inject some people some euthanasia, but I hope that doesn't happen. It's not allowed in Kenya anyway. So, kindly introduce yourself, Dr.
Uh, Thank you, Dr. You actually tried. The pronunciation is Athanasius.
Athanasius.
I'm Dr. Athanasius. Yes. Athanasius. I work in the, I work in the Ministry of Health, at the Department of Primary Health Care, Division of Health Promotion.
Okay. Thank you so much, Dr. And then, yes, our next guest, kindly introduce yourself, Joseph.
Thank you, Dr. Zippy. Thank you, Dr. Atenasia. My name is Joseph Silali, and I'm a filmmaker, and I write stories, and I'm a community organizer, and I'm a partner in Unplugged Communications Kenya. Thank you.
Oh, thank you so much. Dr. I'll start with you. When we're talking about effective health communication in the midst of COVID, when COVID started, or like let me say when this pandemic started in Kenya, CS Kagwe used to give us a brief every day around 3 p.m. And some people say it drove us into panic. It made people feel like, oh, this thing is going to kill everyone. I know there are people who didn't leave their houses for 2 weeks just because of the fear of even touching the gate that other people are touching. And but then again, there are people who are like, it is our right to have all this information. Maybe you can give us from a health perspective what exactly is the right thing to do and why.
Uh, Thank you for that question. Actually, effective health promotion, health education. Actually, the first thing that you have to do is rely on facts. What are the facts that are sharing with us? That requires research. What are does research show us? With COVID, it'll be understandable that it is a novel disease. Not a lot had been done, not a lot had been known. But a few factors are known that it actually spread by droplet infection. That means when you sneeze, you cough, some droplets, whatever comes out like small sputum, is what you call droplets. They get in touch with that person through the eyes, nose, and ears, and from there on, you get infected. So basically, at that stage, those are the facts that we had: avoiding contact, minimizing contact. So basically, that's the message that was being communicated at that time. But by and large, we started getting more and more information, and we communicate more effectively. And the intensity of that communication at that time, having daily updates, was because of actually the not only
Daktari, I'll request
yes.
if you can put your camera slightly up so that you can see more of your face.
Oh, okay, sorry.
Yeah, we are seeing more of your chin.
Sorry. Is that better?
Yeah.
A little higher again.
This way.
Yeah, and now straight. Good. I think that, yes, now it's getting better.
Yeah.
That's better. That's much, much better. Yes.
Mhm.
Good. Yeah, you
So
can go on.
yeah. So initially, the requirement was that actually we tell Kenyans about the possible effectivity of the disease, coronavirus. Is highly infectious, huh? Not 100% fatal, but actually the ones who get serious will really need some high level of care, specialized care in ventilators and in ICUs and high dependency units. Look at the lessons learned from other countries, like where it started, the epicenter in China. It required quite some amount of expertise and specialized centers for treatment. So basically, the danger at that time was that kind of, remember people talk about flattening the curve. So they don't have so many people that they get the healthcare system or it gets overwhelmed needing any healthcare. So basically, it was kind of letting guys kind of reducing the number of people at a time who will need any specialized care. So basically, that was the communication gear at that time. Right now, since majority of Kenyans already know about COVID, I think the latest survey put it at about 95%. But still, behavior and how people practice to prevent COVID remains a challenge. And the knowledge aspect has been dealt with. The attitude, slightly, some people still think it's a rumor, it's a point up disease, where some people want to benefit. But the main thing that you're getting for is the practice, change of behavior.
Okay. Thank you so much on that. I'd like to come back to you, Joseph.
Uh-huh.
Joseph, you are a communication expert.
Uh-huh.
Yeah. We say it's easier to reach crowds through entertainment, even if you're talking about something very serious.
Mhm.
Uh, what do you think is the biggest role that you as a person and many of the artists have
Mhm.
been able to do during this pandemic?
Okay, I'll go to what I do most, that is film and short skit and stories. But specifically, we've been dealing with people with disability. We did stories. We did stories on intervention, on how the government can intervene and help people with disability. And then we had to do awareness videos and skits, both in slums and rural areas. And then we did a little bit, not too much, of photography, which we shared on our online platform.
When you talk about photography, what exactly do you mean? Like, what exactly did you do?
We did stories of how people, mostly we focused on how people are using their mask, if they're using it the right way, or if it's just to keep off from law or the
Police.
police. Yeah. I think they were very simple and means of making things and situation look just the way it was supposed to look at the moment the pandemic started. But we, as things went by, people started to take these things serious, and we saw people doing things the right way. Though we have as we continue doing our thing, which we are using at the moment, we're just using mobiles and just simple cameras. We're not really professional on that, but what we are seeing, people are very, very serious on that, and the communication and what we are getting out, and the kind of people who are actually doing the whatever, the coverage for us and the recording. We what we are seeing now, we are seeing a more enlightened, and people who are following the government directives at the moment.
Dr. Thank you so much, Joseph, on that. I'll follow up with it later. Dr. Right now, we have been told there's a second wave of this COVID. But question is, we are being told that it is stronger than the first one. Yet, for most of us, it is we don't know whether is it really stronger or is it the same one. And right now, the impact is more because people relaxed all over the world. And the question that everybody keeps asking: this COVID, it only gets transmitted at night. Why are we being told to to have curfew only after 10 p.m.? Yes. So during the day, what happens?
Thank you. Thanks for those questions. Actually, about the second wave, particularly talk about Kenya, we cannot really call it a second wave because you realize it actually moved from the big cities, Mombasa, Nairobi, and where there was lockdown, and when the lockdown was opened, it moved to other areas in the country. So you can find other areas in the country is actually not even experiencing the first wave. The infection, most of the counties, the infection has not been reported. It's reported about less than 10. So basically, yes, people have been calling it the second wave, but I think it's just still the first wave. Just that it spread our areas, and due to the kind of reduction of infections. Somebody's else on the mic. Oh, okay. So, relaxed. Travel people are relaxed. Try to spread other countries. And basically, that's what happened, and it's the first wave. And one of the ways to prevent COVID is reducing contact, physical contact. Most of the physical contact is actually happens during socializing. So in a way, you could look at it this way: reducing the time that people have to socialize will tend to reduce physical contact, so that they don't transmit each other. That was the logic behind the curfew. Thank you.
But we socialize during the day. We even have a lot of events on Saturdays and Sundays, and we actually ensure we start socializing earliest because of curfew. So instead of an event starting at 4, we now start at noon, so that by 9 p.m. we are done. But
But okay, fine. That one, yes, that's a plus. But again, you have to balance between the other activities like economic activities and the healthy habits of preventing COVID. Basically, and some Kenyans who in the late hours, that's when they socialize most, and they get inhibited, sorry to say, and they get loose, and that's when they start hugging each other. Physical contact becomes more. So basically, it's not 100% of a sure way, but actually, it's just a kind of a kit of tools, of which is an addition to other tools that we're communicating.
Okay. Maybe that needs to be told to people, because the propaganda around the issue of why at night and why not during the day. Amos, karibu sana. Amos, Unmute your mic. Amos, please unmute your mic. Okay. As we wait for Amos to unmute his mic, we can ask Joseph. Joseph said it is a communication strategist, but I'll ask him a very political question, which Daktari will follow up on later. Oh, Amos, you're back? Hello? Amos, Rachel? Amos, you're back? Amos? Okay. Joseph, you'll answer this as Daktari also follows up. Joseph, Kenyans, we hear that in Tanzania there's no wearing of masks. I've not been there, that's why I say we hear that there's no wearing of masks. In fact, they've been told that there's no COVID. However, we do not hear the number of deaths. Actually, people say if Tanzanians are dying as much and they are free to do everything and move freely and not wear masks, and Kenyans are also dying as much, what exactly are we doing right or what exactly are we doing wrong that they are having the freedom that we are not having, but the death rate is the same? So when it comes to communication, because today we are talking about effective communication, what exactly is not being told to us about this pandemic? Is it an issue? Is it the way it's transmitted? That's not very clear. Why is Tanzania's case not as big as Kenyan's case? Is it that they are covering up and we are not covering up? Like we are very open about the casualties. What exactly is happening? So politically, where is the thin line between the myth and the reality? Yes, Joseph, you can start. You unmute your mic. Yes.
Oh, you're hearing me, yeah?
Now I can hear you.
Hey, that's
That's
a
a political question.
very
I warned you.
funny question. You okay? Let me start, and then Amos is going to help me. In Kenya, actually, we've been doing the right thing. That's what I can say for sure. Because we cannot try to compare Tanzania and Kenya, since in Tanzania, in terms of communication, they really shut like everything out. So even if you try to compare, we cannot come up with anything substantial in terms of this is what is happening and this is not what is not happening in the other side. But in terms of transmission, that one I cannot tell, since okay, in Kenya I can say that the government has been doing the right thing in just giving us the daily updates on what is happening, who is getting infected, who is which people are getting out of hospital or home quarantine, and then the guys who are sadly who are passing away. But for Tanzania, what I can say is that I spoke to one of my friend there, and then she told me that things are okay. She told me things are worse, but these are the stories. The stories cannot be confirmed. But for Kenya, at least we have a clear picture of what is happening and the kind of containment measure that the government is working on. I don't know if I've forgotten anything. Amos can chip in.
Amos.
Mm-hmm.
Oh, I still can't hear Amos.
Okay.
Yeah, but Dr. Ching, maybe you can also tell us about this politics. Yes, when it comes to Tanzanian issue, that is what's going on. That is what we hear is going on. However, when we also look at the Kenyan issue, the most recent or the final time the president addressed us, he told us our health is in our hands, which we did not take very well. We are talking about health promotion and health communication. When you tell people their health is in their hands, there are two things. You would expect that maybe we will take more care, knowing that, hey, now it is us. But a lot of citizens went on rampant saying the government has left us alone. Now the government is not doing anything for us. We have no one to depend on. People went into panic mode. Uh, since you are in that Department of Health Promotion, maybe you can tell us, was it the right statement at such a time? Because nowadays everyone is in panic.
Okay, first of all, the Tanzania issue, I'll have to politely decline because that's kind of a diplomatic issue, which as a civil servant is communicated through the Ministry of Foreign Affairs. But yet, as the previous panelist said, there are no figures coming up there. If there are figures there, as I mentioned earlier, I communicate two facts. That's my job. So there are no facts there to discuss. So basically, I cannot comment so much about Tanzania. About the president, maybe it was misread. I'm not speaking for him, but I think what he said is that you have to take greater responsibility for our health, behaviors, in a way that I think that's the intended communication. The government has not left anybody alone, because even as this festival is evidence that the government is involved and heavily involved in organizing it, and we're still going for health promotion, including employing recently in March, when it takes supplement the health human resource fund that you have. So amongst others, other health cadres of healthcare workers also employed. So basically, we have not left the people of Kenya alone to their own devices. We are still very concerned, including from the ministry up to the level of the president. Thank you.
I'll ask you another question. Recently, the doctors, when we lost the young doctor, the doctors fraternity and the nurses fraternity said they are not being well taken care of. They are not being given PPEs and there are no salaries. If we are talking about this information going to the citizens, let me say like us here, it makes us feel like we are in more of a panic mode. What is your, how do you call it? What was your control? Because we did not hear a statement from the government giving us reassurance. There's that reassurance that as a citizen, if I fall down as a mother, I see my child is falling down, and the neighbor comes and says, "Why are you letting your child fall down? You are a bad mother." I have to defend myself and say, "No, the child was walking and doing this. That's why they fell down, but I'm still a good mother." What we have not felt what the government has come to tell us about what the situation was. And so it has really created a lot of panic. If you go to especially social media, which is nowadays like the mainstream media, because that's where we get all our information. If you go there, people are in more panic now knowing that this is what's happening. So what is the control measure that the government is having towards this kind of information coming out there? Daktari, you are frozen. I think network.
Okay, you can go.
Hey, okay, Joseph, I'll come back to you. It is just me and you. Yeah.
We'll continue and then catch up.
Yes. You are now a communication consultant.
Yes, that's true.
Okay, why are you saying, because the question, you are scared of the next question.
No, I'm ready.
Now, if I bounce that question to you, what do you think is the best control measure? Because here is a case where people are saying this is happening and this is not right. And people are saying this was somebody who was giving treatment and they were not given enough cover to take care of themselves. And this is all over social media. What is the best control measure that can be done by the government in regards to
Doctors?
that kind of information?
Okay, if I'm not wrong, you referring to the case of the maybe an example of a case of the doctor that passed
Yes,
on.
the young doctor that passed on and had not been paid any salary for 5 months.
Okay, maybe first of all, I may not know the how maybe the kind of agreement or contract they had, and okay, for 5
Actually,
months.
what we need to know is not even the agreement. We just like, yes, this information is now out there. The
Uh-huh,
citizens are now scared. What is
uh-huh.
the best control measure to reassure the citizens that things are okay?
Okay, one of it should be like all the doctors should get insurance and should be able to work with the right the right to the work in the right environment, and assure the public that the government is in charge, and whatever mistake, if there was, it has been taken care of.
Uh-huh.
I don't know if I got it.
I can see you're being very diplomatic. Amos,
Yes, that's right.
Amos, how are you?
I'm very fine. I'm so sorry. I was trying to get in through my phone. Apparently, I thought I was very tech savvy, but in the
You
no.
just discovered. Don't worry, every day is a learning experience.
Yeah, it's true, man.
Now, Amos, you are a
Yes,
musician. I believe artists are the voice of the society. We are the voice of what is happening, because art in itself is an expression of reality. As a
yes, ma'am.
musician, and even on behalf of other musicians, what do you think is your role as an artist in terms of empowering communities and the citizens about this pandemic?
Mm. First of all, art using art form as a way of communication is one of the best ways
Amos,
to.
you're frozen again. Oh, lolo. Or
Can
it's
you
my
hear me?
network.
Can you hear me?
I think we are fine.
Yes. Am I audible? Am
Yes,
I
yes, I can
audible?
hear. I can hear you. I can hear.
Yes. Art in itself is best way to communicate, I think, because it actually gets the message across, and it doesn't really limit people to the kind of expression that we can use in communicating a certain message. And I think in this time of COVID-19, we have found ourselves having to change and adjust, especially as musicians, because it has affected us the most. They're the people who actually sing before crowds, they're the people who just, we try to create, um, um, most of our art form, especially as a musician, is done before a crowd. And the COVID-19 hit so hard for artists to some point that the government had to like find a way to give artists something to for as an upkeep, just to keep us going. But we have found a way to communicate through the social media and so many other ways that artists are now using to pass the message across. Our power of communication is now very, very necessary in this time of COVID-19 to pass the message that is necessary to keep people safe. And I think the artists who have come out and have used their celebrity status or their power to communicate, or just their social influence on social media, their numbers to communicate this message, I really want to commend them for that. Those who have created online shows where people can actually enjoy their entertainment and live music, because I've seen many shows that have been done online. The DJs that came online and started to actually entertain people via Facebook and YouTube and their pages, just to still communicate the message of just stay safe, wear a mask, wash your hands. I think it has been effective. Maybe most of them will not be acknowledged for how much they have tried to do so, but I actually really want to commend those who have. I think there has been a gap though as artists, because I have not seen a lot of messages directed to kids. Um, I actually haven't seen any art form trying to create messages for kids. It's very, I don't know if it's a Kenyan thing. The Gengeton world, of course, they have done some few songs here and there, pandemic. Of course, yeah, it's not the best way to communicate, but it's getting the message across. But anything to do with kids, I haven't really seen that. I think there's only one person who I've seen doing it, and he's a Kenyan American. He's a Mzungu, and he's been trying to use puppets to communicate the message of health. And I've seen he's been nominated as one of the people in this competition in Brescia Jenga Jamii Awards. And I think he's one of the few people who have done messages in regards to kids. And I would encourage artists out there, because we have the power to communicate. Let's do more. Let's do more. Let's see the gaps that exist and try to fill them. I've also not had any issues being raised in regards to persons with disabilities. PWDs have not been, how PWDs are dealing with this in this season of COVID-19, and who is actually attending to their needs, from the government level to the streets, yeah, to the ground. I haven't seen that, and I think I would throw this out there to artists to take up these places where there are gaps and start communicating more on those areas, so that we can actually just cover the whole range of trying to help everybody get the message of safety in this time of COVID-19. I think
Thank you,
that's
Amos.
back to you, Daktari.
Thank you. Yeah, before you joined us, Joseph said they've been doing some work on people with disabilities, and maybe they need to share that more so that the information can reach many, many, many people.
Yes,
Sometimes
yes.
we do beautiful work, but it's in the part of distribution where how it reaches the masses is where we end up having a shortfall. Yeah, but
Yes, yes,
true, I
yes.
think apart from Buni Media, they're the ones who do the puppet animation. We haven't really had a lot of content for children. Even if you check YouTube, there isn't really a lot of content for children. Another thing that maybe I don't know if Dr. comes back, he'll be able to tell us. But when it comes to effective communication, the rural areas do not have these YouTube, the platforms like the ones we're using right now.
Yeah.
But still, when you go home, we expect that they know about this pandemic. They should know how to take care of each other. They should know how to wash hands. And sometimes these are information they only hear from people in Nairobi and radio. And a lot of time you realize it, yes, radio is a very effective communication tool, but sometimes people need an image to be able to know even just how to wash their hands. Even some of them don't even know how, these pictures that they show us that how that's how a pandemic, the COVID-19 virus looks like. Some of them have not even been able to see that photo because there is no TV. There is even the newspaper does not reach down to that area of the village, and then when it reaches, they only bring maybe 10 copies because they know one will go to the chief, assistant chief, and maybe principal of some few schools. So they bring those newspapers to specific people, not to everyone to hopefully buy. And so when you're talking about effective communication, yes, we are being told it reached the rural areas quite late. Like right now is when the virus is penetrating the rural areas. Daktari just told us it's not a second wave, it is the first wave reaching the rural areas. But is it that they already got an attack, but then they did not know that what it was? Because people confuse this also for pneumonia. People are having TB issues, and these are things that can be confused with this COVID-19 symptoms. It's good Daktari is back. Daktari,
Yes, yes.
I was just saying, a lot of information is being done in the urban areas using TV, images, social media, and all. But down in our villages, like where I come from, uh, information only reaches people easily through radio because there's one TV among maybe even 10 or so homesteads. The newspaper, only 10 newspapers per village, which goes straight to the chief, assistant chief, and the principals. Now, how do we ensure that these people in the rural area get information effectively?
Thank you. One of the ways, of course, you mentioned a kind of they're using the local FM stations, radio stations, and this has been done actually. Luckily for Kenya, there's a high. There's a local FM station for every region of Kenya now, and it's so easy to reach them through that. And of course, you have the community-owned resource persons, the so-called COP. And if you identify this and kind of give them right messages to give to people, these are the kind of people they listen to, they trust the health messaging. They tend to get the message. Apart from that, we also have trained on what you call the community health volunteers. These are people who have some basic health education, and they kind of check in on the household for household, what the issues are. And they also do for us some community surveillance. So these are people who live within the community, and the people trust them. And when they tell them health, they've been doing health issues for them, like immunization and the like over the years since 2006 when community health started. So basically, there are several ways you can get to them, and actually, if you use these multiple channels of communication, you tend to be more effective. You know, if you hear from more than one source, you tend to believe that's the truth. So basically, that's where you'll be getting it. And actually, the community health volunteers nationally were trained, and they got an update on training on how matters COVID. So they've been passing the message up to the village and complementing what the local health stations have been doing. And this we've been doing mainly in conjunction with USAID partnering with government to give messages out to the community.
I think that's wonderful news. That's wonderful news. I hope even the younger children are getting to hear that information, because a lot of times when barazas are called, or even people go to meet the, these health practitioners, they forget the children. And somebody just said the children are more stressed than parents think. We believe this is a child; they can't be stressed, but children are also going under depression because they can't play, they can't run around, they can't visit their friends, and they can't go to school. And maybe the health promotion department needs to have particularly tailored information for children, because Amos just mentioned there is very little, if any, information for children. Like the ones that we have, the animated on Buni Media, that one is on YouTube, but the children in the rural areas, they can't access that. So maybe we could also work with the health promotion team to see how do we get things for the children in the rural areas. Yeah. Thank you, Dr. Amos. I'll ask you another very political question. Diamond, our very dear friend, you know Diamond.
Yes, I know Diamond.
Diamond just released a very lovely song, Wa. You know the song Wa. But
Anachukua, anabega.
yes, right at huko katikati ya nyimbo he says usiniguze, usinitache, you know, corona.
Yeah, corona, yeah.
And quite a number of people don't hear that part. People just remember this whole song like Kofi and Diamond. But this guy took his very beautiful song and put that warning there for people, like, don't touch me, you know, don't come near me, don't even greet me or high five because of corona. What is your perception on that? Do you think it's a beautiful thing, or what?
I think it's an amazing thing. I think it's an amazing thing, and I think local artists here and there have tried to do the same thing in their music, and it's commendable. I mean, that's the power of art, because when he does that, and you see the views he has on YouTube, it's crazy. They have a media station as well, and I'm sure they're adhering to this kind of COVID-19 practices, and I think putting it in your music is a very smart way of getting the message across. And if people see it, because people follow celebrities, and if you see celebrities taking this kind of thing seriously, they also take them seriously. And I think it's very commendable of Diamond. Yeah, tutachukua na tuweke tu. Yeah, wow.
Joseph, well, do you think it is better for artists to put in a bit of a message in their big song, like, you know, the way Diamond did? Or do you think it is better for artists to compose a specific song which from the beginning to the end is about corona?
Actually, the aspect of just putting that small message there, it works for everyone, because like everyone now knows there is like a message that is hidden there, and everyone hears it, and we are having the best of entertainment. And okay, I'm not against someone who do like all their music has message, but I think according to me, people love fun. And that one actually entertainment, yeah, a lot of fancy words and message, it works for like the whole population. And unlike when you are doing like the messaging, like it's serious message from stanza 1 to stanza 3, they actually maybe it's a certain age group will understand that. But for when you do like a little bit of entertainment and some messaging, it works like 80 or 70%.
Daktari, kama serikali,
Yeah.
what is your opinion on that? Do you think it's better to just have a song where from stanza 1 to the end is on health promotion, whether it's about COVID, or people should just have a fun song and maybe I guess one chorus in between is the one for COVID?
Basically, actually, today we're discussing
Yes.
about effective health communication. And communicate, you have to get somebody's attention. I think that's what Diamond has done. You get their attention and then you pass on the message. Maybe you can have another song passing on the next message. Basically, it's about keeping people's attention. If you start giving people health talk from stanza 1 to stanza, they might get bored and they may not get the most important thing to them. So actually, there are various ways to keep people's attention, and that's what the good of keeping attention so that they get the message, that particular message.
Okay. I think our time is almost up, but I think I just have one question for each of us before we have our final statement. I'll start with Amos so that at least maybe you can have an extended time since you joined us late. What do you think is the next step? Because the pandemic, we don't think it's going to end before Christmas, and we are not sure whether it will end before Easter. What do you think is the next step as artists to be able to empower maybe ourselves or the community about this pandemic?
I think so much has been done so far, and I think a lot of effort and creativity has been put in regards to how people are communicating the message of COVID. As artists, I wouldn't know what the next frontier is because creativity is very fluid. There's no way to like put it in a box and see which direction it's going to go. So I would say let's be as effective as we possibly can because I've seen people use TikTok even just to communicate the message of COVID. And all these are creative ways that we're using to just create. At this moment in time and at this day and age, very many millennials have become content creators. So artistry has not been limited to us who are musicians. Um, just the whole industry has just been filled with so much creativity and kids coming up with crazy things. Even in the film industry, guys are shooting right now with phones and they're creating very interesting concepts. As you have seen in this particular festival, how creative guys can get with the little they have just to create a message. We actually didn't even know we would get so much content of just people trying to be creative in communicating the message. But you can see, giving people the opportunity to do so has a way of bringing out the creativity that they have. And I think I would just encourage them because I really don't know. Somebody might come up with a creative way or a new technology and innovation or a way to just communicate because COVID has just made us creative in the way we communicate. I think we should just hope and pray that whatever means and the means that we're already using, they become as effective as possible. I'd also want to urge people to just adhere to the COVID-19 preventive measures. Yeah, take it seriously. Guys are dying until now. I think the cases are still going up. And right now, vile watu walikuwa wanasema kitambo ati mi sijui mtu in my family mwenye ameshikwa or I don't know anybody close to me who has died, so I don't think this thing is real. I think by now we have seen cases that are close to us by now and it has become serious, especially for people like our parents who are very vulnerable. I think it has become something that we actually need to really check. So for artists out there in whatever art form, film, music, whatever art form that you're using right now, from audio to visual to audio visual, just be very direct in your communication. Be as creative as Diamond if you can be, but just pass the message across because we have as creatives and as artists, the mandate to use our platforms to communicate message that helps people. Thank you, Dr.
Thank you so much, Amos. Joseph,
Ah,
how do we reach the marginalized? Because you've been creating content. You said you've been working with people living with disabilities, but how else do you think we can reach the marginalized people? And marginalized here is not just people living with disabilities. Marginalized, also in this case, children are marginalized.
it's true. It's true.
Yeah, children are now a marginalized community when it comes to COVID, and of course, the very aged. Well,
Mm-hmm.
like Amos has said, our parents are also as scared of getting of this pandemic, and a lot of us, especially some of us from Western Kenya, like Dr. Ochieng and I, when it comes to holidays, we want to go home and stay there. But now for this Christmas, a lot of things will have to change. So how do we reach the marginalized, the aged, the young, people living with disabilities, and people deep in the rural? Yeah.
Okay, thank you, Daktari. Amos said creatives, like we don't have content for children. Now I think this is an opportunity for the creative to come up with very simple content for the kids, and then even for the agencies and for government to start working together with those people, like-minded organization, the people that deal with the creation of content, and then for the marginalized, I mean maybe the old ones, the old guys. A lot of information can be passed through mother tongue, of which I heard doctors saying that they usually use radio and local station, locally community stations, and maybe when you talk about marginalized, I'm thinking of the rural. We're talking of those remote places where we can have the community empowerment of the community health workers, since those are the people that are in contact with like everyone there. Since I think every community and every area has those people. To me, I think that would be my suggestion.
Mm-hmm. Daktari, don't disappear. Daktari, don't disappear, please.
I'm here. I'm trying to manage the kids also to join me.
You're trying to manage the marginalized community.
You have to join me. That's what at this room. Initially, I didn't get they found me there.
Don't worry. Let them come on screen. It's a learning experience for them too. I want you to maybe tell us something about traditional midwives. The reason I'd like to talk about them is because right now, quite a number of women who are pregnant are scared of going to hospitals because of fear of getting infected, and also there's the fear that not many doctors are in the what in the hospitals working, and also there's the fear that there are not enough beds because a lot of them are occupied. So this is the one time that traditional midwives are, I think, more useful than any other time. Maybe you can tell us what exactly is the Ministry of Health doing to see on the issue of maternal health care during COVID. I'm asking this one particularly because we can't stop giving birth. It is a natural course. And so, what do we do?
Thank you for that. Actually, it's good you mentioned about that because that goes to the it's one of the essential health services, maternal care, including things like vaccination, provision of antiretrovirals and the like. So, first of all, I'd like to often say that it's a government policy not to encourage traditional birth attendants. They're called traditional birth attendants. We like to as much as possible, to do maternal care, including deliveries. That having said, maybe that's one of the things we're catching our heads over on this continuity of services in the advent of the strike. But even so, what the lessons we've learned from previous strikes, that even if majority of healthcare workers on strike tend to kind of stay.
Can't hear you well. Put
Sorry.
the mic. Oh yes.
Okay, fine. What's the last you had?
The government does not promote traditional midwives.
Government policy that as much as possible, and this is what we report even in our monitoring, a number of skilled births covered in whatever region there is. Whatever region there is. So basically, I've gone on to from previous health worker strikes. Even if majority of them are on strike, you'll have a skeleton staff, of which they'll be able to attend to emergencies. And I think woman is one of the emergencies. I've not been able to look at the data. I don't know if there's any change because the strike has only been there for about a week. So I'm not able to say if there's any that it has done to the essential healthcare services.
Okay. Thank you. So I'll just maybe give each of you 1 minute to say the final word, and then we can end the session. Anyone can start.
I can start.
Okay.
For us to at least do the right containment measures, we just use very simple and common language that everyone understand, and according to where we are. I think with that one we'll go ahead and at least contain the pandemic.
Okay, thank you. Yes.
Is it going alphabetically? Am I next now?
I think.
Go ahead.
Athanasius, you can go ahead, Doctor.
Thank you for this, and thank you for the guys who came up with this idea, and it's actually something very novel. We've been doing a lot of communication, but COVID has actually made us to reinvent things. A lot of communications we have to do, in case even if it's audiovisual or edutainment, as Dr. Salim had mentioned earlier, start to be kind of involved with some physical meetings and the like. This innovation is what God puts us the next way forward, and we're looking forward the health promotion, kind of using this more often to pass on messages of health, hoping to be able to reach people in a way that are dedicated at the same time they're being entertained, to maintain to kind of pass on the message effectively and towards health, towards their all personal health. Thank you.
Thank you. And Amos, your final word.
I think when I was made brand ambassador for this festival, I've never been so proud to represent anything in my life. I've been so proud to represent us, and I took it with great honor, because this is one of those things that we are in the middle of communicating. You're in the middle of a pandemic, and coming up with a way to just have people communicate the message back to their own people is a really powerful thing. Like giving the power to the people to communicate the message in their own creative way, and creating a platform where they can all come and communicate that, where it's on a national level, where we can actually address the situation with one voice, but creatively in different ways. I think that's a very beautiful thing. And this is actually one of its kind. I don't think there's anything like this in Africa. And I think we should be very proud to be part of this. And we should actually, I believe that the impact of what we're doing right now will be felt by how much people we are able to create. We may never really know, but by creating this kind of platform and allowing people to communicate the message, we have empowered them to be also responsible for how we are going to save the next generation. And I'm grateful for this opportunity to even be in this panel. I think I'm the only one who doesn't have doctor on his credentials. It's an amazing thing to be here with such incredible people who have done so much. And I want to really, really commend you. And I thank you for allowing me to also share this platform and doing this thing. Thank you so much, Dr.
Thank you, Amos. I am glad to share this platform with you. I think when we are done, we'll come and eat that chicken in your background.
Yeah.
That sounds like a big house ready for Christmas festivities. Ama just have to go for the
Yeah.
kuku kwenu.
Ni ya Christmas yetu huko.
Joseph, invite us, Bana.
We'll do.
Virtually, avoid gathering.
Avoid gathering.
No, we promise to keep social
that's
distance.
before of us.
The chicken gets smaller.
No problem. I just do like half, eh?
Yeah, awesome.
All right, thank you so much, guys. So just some of the few comments, like 3. We have PC Band Kenya who say we are called to serve. Our target is to make sure everyone gets the information. We are every day at the ground creating awareness within Nairobi sub-counties. Wear masks, sanitize, stay safe, COVID-19, and Merry Christmas. So you can look at PC Band Kenya. Marima Sianoi also said some of the child focused agencies have been engaging children directly, and I think that's nice. Community engagement is the way to go using CHV. I don't know what CHV is. Doctor, you know what CHV is?
Community health volunteers. Remember, I talked about it earlier on.
Oh, okay. Using community health volunteers and community-owned resource persons to spread messages at community level. All hands on deck needed to beat COVID-19. Okay, and she agrees with Amos. There's need to engage people with disabilities, and we need to continue involving artists so that they can reach out to their fans. They also need to lead by example, like when we have events that are full of people. We need to lead by example by saying the president said 200 people max, so we don't accept people to buy tickets exceeding 200 people. Anyway, Darren Collins is asking, ask Dr. Pamoja is released in 5 more languages next week. Oh, that's beautiful. Yeah, because we say that Buni Media are the only ones who have done something for children. And it is good to hear that now they're going to have 5 more languages. So far, they already have English and Swahili. I think I've heard my language, Luo, in it. And I want to believe 5 more languages will definitely reach more children and more people in the rural areas. And with that, I just want to say thank you so much. Rachel,
can I say
back to
something?
you.
Can I say something?
Yes, that can
I've seen Darren Collins.
Something.
I think I've seen Darren Collins.
I don't know if there's some background noise. Rachel, is it you? Rachel, you may need to.
No.
It's not you. Joseph, then it's your cock.
Yeah.
No.
You're just Yeah, I think I was saying I've seen Darren Collins on the chat, and I think it was him I was referring to. Ask Dr. Pamoja, and he's doing incredible things with the kids. And I think he's creating kids content with puppets, and it's incredible. And I think right now he's saying that he's releasing it in 5 more languages. I mean that's really good. Yeah. So yeah, I love it. Back to you, Dr.
Thank you. Rachel, we just want to say
okay, thank you very much. I think mine is to pass a vote of thanks. Yeah, so for me, I'll just like to pass a vote of thanks. to the wonderful panelists who participated in the discussion. Dr. Zipi Okoth, you're a wonderful moderator. Wow, we've just enjoyed this session. We've learned a lot from you and from the questions that you asked. Amos, our ambassador, thank you very much. Festival ambassador and a great Kenyan artist. Thank you for your insights. Dr. Ocheng, wonderful insights. Thank you very much. And Joseph Selari, thank you very much. I enjoyed the discussion. And just to the viewers, get tuned at 2 p.m. for another interesting panel discussion on mental health awareness. And we thank you so much, so grateful for your support of the Boresha Afya Jenga Jamii Audiovisual Festival. And by the way, we are proud to say it's the inaugural health promotion festival in Kenya. And hopefully, who knows where this will go? Maybe it will go to the African space. And the most inspiring thing, people are the people who submitted their content. We've learned so much. You've inspired Kenya. And also, immediately after this broadcast, kindly go to our Facebook page, our YouTube channel. We are actually like screening a lot of the productions that was selected in the festival. So thank you very much. And until 2 p.m. when we meet again, I take the role of MC. And we'll see you then at 2 p.m. Have a good lunch. Thank you and bye-bye. Bye.
Bye, bye. Thank you, guys.
Thank you.
Tunaenda kukula kuku ya Joseph for lunch.